So the title of his talk is Leveraging Digital Patient Engagement Technology to Improve Clinical Outcomes, Evidence-Based Practice, and Lesson to Learn. Just a quick words about Dr. Liu. He has an amazing profile. Dr. Liu is a physician turned co-founder, CEO of Seamless MD, a digital patient engagement platform used by health system to engage, monitor, and stay connected with patients across healthcare journeys, surgery, oncology, maternity, chronic care, and many more. Seamless was the first digital patient engagement platform to achieve turnkey integrations with Epic and Center. This is amazing. I mean, the people probably not familiar with the complexity of the electronic health record, and that is very amazing to have something that easily can integrate in the health in the electronic health record. He has validated the platform by 25 plus studies evaluation to reduce lengths of the stay, readmissions, ED visit, and costs. Joshua has also served as chair of the June Innovation Council for Canadian Medical Association and on the advisory group to the Office of the Chief Health Innovation Strategies for the Ontario Ministry of Health. Joshua has been named a Digital Health Executive of the Year, Forbes 30 Under 13 Healthcare, and holds an MD from University of Toronto and Bachelor of Science from York University. It's an amazing profile, Josh. With that, Josh, we are listening to you. The title of Dr. Liu is Leveraging Digital Patient Engagement Technology to Improve Clinical Outcomes, Evidence, Best Practices, and Lesson Learned.
Perfect. Thank you, Bijan, for the really exciting introduction and for the opportunity to present to this group here. And also, I do know a friendly face, Anand Nayak. Anand, you saw Seamless MD way back when it was nowhere near what it is today, and then you partnered up with us and with Baylor College of Medicine, the group there. So you definitely played a role in shaping where we are today. So thank you for that. I'm gonna share my screen here, and just to give you a bit more context for myself before I get into what we do and what we've learned along the way. So I started off, as mentioned, more clinically, did my medical training up in Toronto, and I ended up falling more in love with quality, safety, and patient experience as opposed to a very specific clinical area. I had some fantastic mentors who got me hooked specifically on studying readmissions prevention. And by the time I finished my training, I started getting into technology and startups and wondered, gosh, isn't there a better way to use technology to engage, to monitor patients, to prevent an outcome such as a readmission? And long story short, I was very lucky to meet a couple of brilliant engineers, and we decided to go and start this journey, and it basically became my full-time gig. This is the problem space that we've come to really work on, and it's one that, frankly, probably a lot of folks here know better than me. But if you've ever been a patient or a loved one, this journey, unfortunately, is familiar. So whether you're going through a surgery, a cancer journey, a chronic episode of care, you know that we give patients lots of verbal and paper instructions to guide them across these journeys. And we hear a lot of challenges with that experience. Patients will tell us they lose instructions, they forget them. There's no day-to-day reinforcement. It's not very personalized to their individual comorbidities or demographics. And ultimately, that makes instructions and care plans very hard to follow. On the other side, providers will tell us that there's no easy way to keep an eye on patients as they're going through these journeys. There's no easy way to monitor them, which is increasingly important because the vast majority of the patient journey happens when you're at home in the community and not in front of your healthcare team. And as this group I'm sure knows very well, if patients can't be compliant with their care plans and providers can't keep an eye on how you're doing, adverse outcomes can happen, whether that's higher than expected length of stay in hospital, avoidable ED visits, readmissions, other adverse outcomes, and ultimately higher costs to the healthcare system. Of course, these are not new problems. These problems have been around for decades, but really there's been a couple of key drivers that we've seen to really make something like Seamless MD relevant and possible today, on top of the fact that the technology around, mobile and cloud and web are available. The three forces that we've really recognized have been, first, as you all know, the shift to value-based care. As of 2021, the estimates are that now about 41% of payments are tied in some way to quality or value through an alternative payment model or other means. And so for the first time, healthcare providers are incentivized financially to care about what happens to a patient outside the physical, hospital setting. For the first time, you are increasingly incentivized to coordinate care, to not duplicate tests, to catch complications earlier. And, we're expecting to see that rise in the shift to value-based care over time. Second of all, there's been the rise of patients as healthcare consumers, and this has certainly come to light in the past couple of years, especially. But more and more patients are expecting the same digital convenient experiences in healthcare that they're now getting in retail, even banking. And so healthcare is trying to catch up. Probably one of the most prominent things that we're seeing at the health system level is the rise of these roles around digital. So some of your organizations already may have a director, a VP, or a chief digital officer whose goals are to deliver digital transformation across the enterprise, and a digital patient engagement experience is an increasingly important part of that digital transformation. And then thirdly, and very obviously, COVID, as terrible as it's been for the world, one silver lining has been that it has created that crisis and that need to shift to digital more rapidly. And I would say that, from our experience, telemedicine and video visits were the lowest hanging fruit when it came to adoption of technology during COVID. It was, telemedicine was the technology that most healthcare systems had, but was just, very poorly adopted, and was the low hanging fruit to really stand up during COVID. I would say digital patient engagement and guiding patients digitally through episodes of care, it was brought forward during COVID. It didn't get quite the lift that telemedicine did. And part of the reason for that, as I think you'll see as you learn more about what we do, is that most organizations, didn't have this experience before. Most still aren't looking forward. It's still a relatively new category that we're building out. Although that might be obvious to this group, I can tell you there are a lot of folks in the healthcare system who aren't even thinking about going digital in this way, but definitely COVID has helped bring things forward. I'm going to give you a bit of an overview on where Seamless is today, and then I'm going to get really nitty gritty on the platform, the evidence, and what we've learned from it. So high level, we guide patients through what we call digital care plans. And I'll show you some examples of that in a few slides, but imagine a patient going through an episode of care. That could be, let's say, a heart surgery. Patients are guided every step of the way, pre and post heart surgery with, clinically specific and relevant content, progress tracking, education, et cetera, to keep them on track. The second thing that we do is all the data that we collect from patients across that journey. So that could be patient-reported outcome surveys, that could be clinically specific issues and symptoms and recovery milestones for that journey. All that data goes back to real-time dashboards that healthcare teams can use to get alerts and monitor patients and catch issues much earlier. We also collect a lot of data and provide it back in aggregate. So for folks from a research or QI point of view are often using that data to drive broader initiatives. Of course, we have to be HIPAA compliant. And even though you don't have to use Seamless MD integrated with your EHR, I would say more and more of our health system partners are delivering integrated experiences with us because it really does streamline the provider and patient workflow. And I'll share a bit about that work later on as well. We're doing this work across North America with quite a mix of organizations. So I would say early on, it was typically the academic medical centers who were partnering up with us first, but now it's really become more and more mainstream. So anywhere from large, community health systems to even smaller rural hospitals, we're doing, a fair bit of work across the board. And I would say a key reason that we've seen increasing adoption in the space has really been our focus on evidence. I think you'll find there are a lot of technologies in the market that look nice and feel nice, but haven't been proven to drive an outcome. And one of the things that we've done well has been really laser focused on not ourselves actually doing these studies, but really as our partners and supporting their desire to get data out there, to present, to publish, to put things out there. So they do this as standard of care, but they really want to get the results out there. And what's given health system executives confidence is that our approach and our platform has had great outcomes come out of it across not just different metrics, whether it's length of stay, readmissions, cost, et cetera, but the fact that we've done this across multiple specialties now just gives a lot of confidence to health system providers and executives that this approach can work at scale across an institution. And I'll dive deeper into some of these pieces over the course of today. So to kind of give you the full view of Seamless, what I wanted to do was go back and forth a bit. So I'll walk you through different parts of the platform and how we work with clinical providers. And then I'll also kind of dovetail in different learnings, different evidence pieces. So it's a little bit more interactive from a presentation point of view. On the patient end, it is a cross-platform experience. And so as a patient, you can access this on, as an app on your Apple or Android device. You can also access it through a web browser as well on your desktop, also through the web browser on your phone or tablet. And being cross-platform, we found to be really key for accessibility. I can tell you when we first started the company, we would actually sit down next to older patients in clinic, and we'd see how they would interact with these different form factors. And one of the most enlightening moments for me was sitting next to a patient in their 70s, and she had an iPad in her bag, but then when you watched her interact with it, she didn't know her App Store password. And so she couldn't use the Apple version off of the App Store for Seamless, but she could use the browser version. She could, she enjoyed our email reminders. And so we found it really important to reach patients how they expect to be reached and not assume that just because they have an iPad that they can even download an app in the first place. And so being multi-channel has been really key for adoption. Within the actual application, we actually brand it for the health system or hospital. We put portraits of the clinicians inside the program as well. We find that when patients know that this has been vetted and it's been personalized for them from their own care team, the compliance is just much better. And then providers really like that because they actually vet everything in here, they know that their patients are accessing protocols and education that's matches the care plans being given to them, verbally or on paper by their care team. A couple of the types of key features that we use to engage patients. One is we have this we call a home screen where we push out educational cards, reminders, digital check-ins to patients at different time intervals in their journey. And so we can automate step-by-step when they get things. So we can tell patients, hey, it's 7 days before your surgery, stop your blood thinners today, et cetera. We also push out these reminders by text or email as well, so that patients who want different modalities can get what they prefer. There are daily to-dos that also change based on where the patient is in their journey. There's a whole library of evidence-based education as well. And what we actually do is make sure that all this content is not only clinically relevant based on the evidence, but everything meets health literacy guidelines. So everything's at the grade 6 reading level. We use adult learning and health behavioral change theory to really ensure it's not just the technology that's accessible, but also the actual content and how it's delivered is accessible to patients as well. And then lastly, we do a lot of really interesting work around making sure that the way we capture data from patients, so different types of patient-reported outcomes and progress tracking, is as clinically relevant as possible. And so, for example, for a patient going through a total knee journey, we actually have these kind of validated self-reporting tools for, how far can your knee bend? And providers really love that because it allows them to capture truly clinically specific and relevant data points from patients and not just generic, patient-reported outcome data points. And to give you an example of, what this looks like for specific digital care plans or healthcare journeys, to frame it for you, we have these out-of-the-box digital care plans as starting points for providers. And so those care plans have, out of the box evidence-based content, reminders, data tracking, workflows, algorithms, et cetera. We've done this across, different surgical specialties, women's health, oncology. We're getting to more and more chronic care as well. And what we find is that most healthcare organizations will use 80 to 90% of what's out of the box because it's very high quality. And there's like 10 to 20% that they may tweak to match very specific protocols in their organization, because let's face it, we all do things a little bit differently at our organizations, but you need that level of customizability because you want to make sure that what a patient is engaging with truly matches what your care plan is and your protocols are in the organization. And it also gives a lot of ownership to the clinical teams, knowing that their vision is being what's mapped onto the platform. But the reason the out-of-the-box care plans really matter is that we find that clinicians are incredibly busy. They don't have time to build these from scratch. They want something that's very high quality, that they can, as close to as possible, make it turnkey to implement and get it off the ground. And so in order to make this possible, one of the unique decisions we made as a company was we weren't going to be like 99% of the companies out there where, maybe you have, a clinician or two involved, but it's almost all, tech people otherwise. About a quarter of our team actually comes from a clinical background. And what's neat is that when we work with frontline clinical staff, they're actually working with a frontline clinical person on our team. And so your vision is being understood by someone who's actually, been there clinically and can get your vision. And our clinical partners love that because, whenever they're so used to talking to only tech people that sometimes they get sick of it, but knowing they can communicate their vision to someone clinical has been really powerful. What do these actually look like? So just to give you an example of a few. So for a total knee, you can collect very specific, orthopedic PROs, deliver very specific exercise education, track orthopedic specific data. In maternity care, you may be delivering more, tracking on postpartum issues like mood, breastfeeding positions. So it gets pretty specific. Heart failure, for example, we're tracking more biometric data points, et cetera, et cetera. And so just to give you a sense of the clinical relevance of this. One of the things that we've done well is really figure out how to drive adoption. I'm sure people here who've worked with patient portals have found that as nice as they may look and feel, adoption has often been quite low. This is data that was presented by the University of Alabama at Birmingham at Academic Surgical Congress, I think 2020 or 2021 actually. And over an almost 1,700 patient sample, they had almost 95% of patients adopting Seamless MD and about 5% declining it. And this was across actually, a fairly complex population, patients undergoing cardiac, thoracic, colorectal, or gynecology, oncology surgery. So this is not your young bariatric patient. These folks are quite complex. And so what we've seen is we can actually get really high adoption if not just the technology is good, but the implementation is good. And how do we do that? So what we've learned is a couple of things. One is you need to have all these accessibility things in place as part of the experience. So we talked about, multi-platform access. We talked about health literacy, but there's all these other little things that we found to be important. So things like meeting large font guidelines, having the whole platform be screen reader friendly, contrast tested, colorblind tested. About half our patients actually have a loved one enroll in the platform with them. And so we've even had cases where a son or a daughter, might live a state away, but they're staying engaged on the platform to support their loved one, to keep them on track, keep them accountable with the journey. And then lastly, we've always stayed close to the patients. So even today, we conduct regular patient feedback interviews so that we can actually continuously improve the patient experience over time. And so that's been one of the unique things, I think, of what we do. Some organizations have tried to, in some ways build this from scratch on their own, but, we literally work on this problem, 7 days a week. And so any learnings that we get across our network, we pour back into a central platform that benefits all of our clinical partners. Just to give you some data. So this is an orthopedics case study. And through this kind of very high engagement method, we could see activation rates often as high as, high 90% activation, and fairly high collection of patient-reported outcome surveys, between 50 and 80% across different time points in that journey, pre-admission, post-discharge, et cetera. One of the really neat things that we've also done in the platform is find ways to really personalize the care plans based on that patient's background and also their progress in the program. So on the left here, if we learn, for example, that the patient is diabetic, either because we've pulled that data from the EHR, or if it's not integrated yet because the patient tells us that they're diabetic, then only those patients would get extra, preoperative diabetes protocols. If they're a smoker, only those patients would get smoking cessation protocols on the platform. If you're none of those things, you don't get that. And so what we found is that when patients have a truly tailored experience, again, they're more compliant. The other neat thing that we've done is based on how a patient is progressing, we actually give them real-time feedback on what to do. So there are a lot of platforms out there where it's very one way, right? Where patient records a vital sign or symptom, and you need a provider on the other end to be, monitoring that to make an impact. We've gone the route where the base layer of Seamless actually is automated self-management. So for example, if the patient tells us, hey, I'm in hospital, I haven't mobilized at all today, and the goal for that day from the care team was, no, you need to walk, 3 laps in the hallway today to get home sooner. Patients get immediate feedback saying, hey, like, here's where you're on track, here's where you're off track, and here's the behavioral change reason why you need to start walking today, because walking helps prevent blood clots. And what we found in our research is that when patients actually get feedback on why they should do something differently and what they should do, they're actually more motivated to recover and follow their care plan. And so what's been really powerful about this kind of automated feedback loop is that we found many cases in our data that even if no one's monitoring this data, better self-management, better engagement drives better compliance with protocols and drives down metrics like length of stay. So this is data that was published by Rush University Medical Center a couple of years ago on their colorectal surgery population. And they were a team where they just didn't have the resources to monitor patients and monitor this data. And so they used Seamless purely as a self-management program. They had an enhanced recovery after surgery program in place for a few years. So for those who aren't familiar, enhanced recovery is a set of evidence-based standardized protocols across the surgical journey. And it's kind of like a bundle of elements that have been proven to reduce complications of length of stay if followed by providers and patients. So it's things like pre-op carb loading, early mobilization, avoiding narcotics, et cetera. And so they actually had an ERAS program in place. Their length of stay and their metrics had kind of plateaued after implementing it. And so they brought Seamless in. And by just getting patients engaging with those very same protocols more effectively on their own, they were able to demonstrate a 2-day length of stay reduction, better adherence to things like SSI reduction elements, 70% reduction in SSIs, better compliance with bowel prep, and most importantly for administrators, over $2,000 in reduction in length of stay. One of the other neat things that we do is when patients are recording issues, we also push self-management content to them. And because what we found is that when you're tracking a patient's symptoms or warning signs, particularly post-discharge, 80% of the issues that have been recorded in the system are not red or yellow flags that need attention by a provider. 80% of the time, these are common issues that if we could just give the right self-care content at the right time, patients can manage well on their own. So it's things like constipation, 3 out of 10 pain, common questions about recovery. And so what we do is if patients track these low risk issues such as constipation, we immediately give them that feedback. And what's really interesting is that for these low risk issues, we're dramatically cutting on phone calls. So this is data that was produced by WashU in Missouri. And they actually checked their call log data from patients post-discharge, and they demonstrated a 65% reduction in phone calls because we were just basically tracking all the common issues ahead of time and mitigating those questions by just giving content earlier. Now, of course, 20% of the time, as I mentioned, there are going to be issues that might need to be escalated to a provider. So for example, if a patient records, my incision is red, yellow, and swollen, and they take a photo of their incision, that is something that a provider does want to know about. In those cases, patients can actually be prompted to call the right number. And so even if there's no one available to monitor this data, patients are being directed to take the next step. But I would say increasingly more and more of our clinical partners are turning on alerts and dashboards like you see here. So that way, let's say a nurse practitioner can actually get alerted if a patient has signs of an infection. They can log into our dashboards, they can monitor the temperature, those symptoms, photos of the incision, and they can proactively reach out to patients and call them up and potentially treat something sooner. So very commonly, we have providers telling us stories about how they caught a surgical site infection remotely. They call the patient up, they give them oral antibiotics, they treat things remotely, and things get done earlier, and they mitigate an ED visit or readmission down the road. This is an example of some of the benefits of, if you're actually doing monitoring, what can you achieve with it? So this is data that was produced by Baystate Health in Massachusetts. And so unlike Rush, Baystate had the resources to monitor patients, particularly post-discharge, and they were able to reduce, readmissions by 72%. The other neat thing was that, and we're seeing this with many other partners, when patients know that they're going home with this platform, and providers know that too, it gives both parties more confidence to not only have an earlier discharge by a half a day or a day, but it gives the patients confidence to go home instead of to a skilled nursing facility or a rehab facility. So especially if our partners are in a bundled payment, they're seeing this more and more as a great platform to get patients safely home, as opposed to something like a sniff. I mentioned before that we're seeing a lot of usage of the data, not only in real time for an individual patient, but actually in aggregate as well for research and QI. And one of the really, just one really neat example is that we've seen lately is with the opioid crisis, more and more of our partners are actually using Seamless to track post-discharge opioid consumption. So when patients go home, they're actually being asked each day, well, how many pills of oxycodone or whatever you're on are you taking? And then on the back end, on the dashboards, we actually graph for the providers, what is the average oral morphine equivalence of that opioid use, and what does it look like over time? And what's interesting is that, we have some providers who find out that, hey, maybe I'm prescribing, 15 pills of narcotics per patient, but the average patient is saying we're taking, 5 or 6. Okay, well, maybe we can start prescribing 10 instead and seeing how that affects pain levels or patient satisfaction. But without this data, we do not have the confidence to actually make those changes, or we don't have the confidence to go back to our providers and say, hey, why do we need to prescribe so much? Patients are saying they're not using the full 15. And so the aggregate data is actually being used in very, very unique ways to change practice. Despite all the importance of outcomes and data, I think at the end of the day, one of the really important things that we care about is, does this improve the patient experience though? And these are actually example quotes from a single institution across a few different clinical areas. But we commonly hear, especially during COVID, comments about how we've helped catch complications earlier, how we've helped reduce anxiety because expectations are clearly laid out for the patient journey just in time. Patients love the fact they're being monitored and being able to send pictures of their incisions from 3 hours away. And they feel like they're getting, through the roof patient care. We've had patients comment things such as, I'm so glad I went to this health system instead of the one across the street because I'm getting a much higher level of care through this platform. So lots of really great feedback about elevating the patient experience on top of just the clinical outcomes. People always ask about EHR integration. So I thought it'd be valuable to share a little bit about that. So for those who aren't familiar, Epic, Cerner, and some other systems have increasingly opened up their integration ecosystems a little bit. And so we actually are approved on both Epic and Cerner's. You can think of them as app stores, but they are very, let's call it approval required app stores. We were actually the first patient engagement platform to get these turnkey integrations approved with Epic and Cerner. And what that means is that we basically, well, unlike traditional integrations where we would have to go to IT at each health system and do a custom integration and then repeat that custom work every time at a health system, we work directly with Epic and Cerner. We created a turnkey integration that they've approved. And so IT can just log into Epic or Cerner's website and then access our turnkey integration and basically go live with an integration in weeks instead of months, while also having the assurance that it's been, security and privacy approved. And actually Epic and Cerner assigned their own people as part of the integration implementation to help streamline the process. And so IT gets really happy about something that is turnkey, less work, et cetera. And without getting into too many technical details, I would say some of the key workflows that this has really helped have been, number one, these integrations actually allow Seamless MD to be embedded right inside the patient chart. So let's say you wanted to enroll a patient into Seamless MD. You don't have to log into our platform separately. You don't need a separate login or password. You go into, let's say, Epic or Cerner, you click into the patient chart, you click the Seamless MD button, and you can basically automatically enroll a patient in Seamless. And then if you want to monitor them, you can actually get all the dashboards right inside the patient chart. You don't have to leave the patient chart. So it's truly a seamlessly integrated user experience for a provider. And then also we've done integrations with patient portals like Epic MyChart. So that way, even for a patient, you could just launch Seamless from MyChart and you don't have to have a separate login either. And so more and more, we're kind of connecting our platform with the existing information systems to truly streamline that experience. Just one example of that, because people often ask, well, what does that actually look like in real life? So this is work done with Catholic Health in New York. And what we did with them was we did a few integrations. One was we automatically pulled data about the patient's name, background information, surgical OR dates, things like that. So that way a provider doesn't have to type that into our back end. We did single sign-on to kind of, not need a provider to log into our platform. And then they also did not only MyChart integration for patients, but also Epic has, if you're familiar with Epic, has an in-basket message feature where all of your internal messages come through. We set integrations where we can actually create alerts inside in-basket, so that way you can get notified about patient issues from right within Epic, and then you can basically then open up the dashboard. And so they actually did some great work on using this to cut down on readmissions for patients while also elevating the patient experience. And we've done a lot of great work with Epic, to the point where actually a few months ago they invited us to headquarters to present at their annual conference on delivering Epic integrated digital patient engagement and remote monitoring. So for us, it was a big highlight to get that recognition from Epic about our work together. I'm going to close off with just a couple of other learnings around how do we actually make this successful. And I think one of the things that a lot of technology folks don't realize is that technology is one part of it, but the implementation and the support is the other big chunk of making a healthcare innovation successful, especially if it requires change management and directly affects kind of the patient experience. So whenever we work with the health system, we don't just hand the technology over and say, good luck with this, I hope it works out for you. It very much is a high touch partnership model. And so there's a whole team that actually gets assigned to the partnership, particularly during the implementation. So we have someone called a customer success manager. This is someone who not only project manages the implementation, but they are the day-to-day partner for the lifetime of the partnership. So ongoing, they are helping to train staff, provide best practices on engagement, driving outcomes. They do data reviews with the team. The patient education specialist is that clinical counterpart who actually helps customize and configure the digital care plans to match your team's vision while still ensuring that the changes meet best practices for accessibility, literacy, and so forth. So that way, the programs drive high adoption and engagement. We've learned that your team doesn't have time to deal with patient support issues that might come up about the platform, and so we own all of the ongoing tech support for patients and providers and other staff. And then also, because patient safety is paramount, we actually have internal team members who, for any algorithms and workflows that are done, we actually test all of those because we have to make sure nothing could potentially go wrong, from a patient safety perspective. We also have to make it as turnkey as possible. And so all of our, materials around training, scripts, posters, brochures, all kinds of things, that becomes part of the partnership too, because there's no point in your team or a clinician having to figure out from scratch, well, how should I educate a family on this? What's the right wording? What's the right messaging? Because if that's done poorly, you can have the best platform in the world, but no one's even going to, log in for the first time. And so we've learned we have to truly bring that as part of the partnership. And then the last thing I'll just cover is we found it to be really important that any solution digitally like this has to be flexible to the clinical workflow, because you find that there's just diversity of staff resources available. And so we have some partners that need this to be very hands-off for the frontline staff, where maybe the most they can do is get the patient a brochure, mention Seamless, at the time that they first enroll the patient, let's say pre-admission, and they just don't have time to monitor patients. And Seamless is purely a self-management program. All the way to the other end, where we have some partners who are flush, fortunately, with the resources, and have decided to not only give a brochure to a patient and educate them verbally, they even demonstrate how to use it. They reinforce the importance of being engaged with Seamless, pre-admission, in hospital, after discharge. They have teams of providers with all these custom alerts and dashboards and interfaces to monitor patients. And the truth is, yes, the more engaged you are, the more patients are engaged, the better their outcomes. But the reality is that everyone has different resources available. And it's not uncommon that we have some partners who start off very hands-off, they're not monitoring patients. And then over time, as resources change, as priorities change, they slowly add on all these other layers to get more value out of the platform over time. So my point is that we found that you can't be a one-size-fits-all. Hey, you have to either monitor patients in real time or you can't engage patients with tech. No, you have to make it flexible, because we just are all coming from different situations. I'll stop there. I hope that provided you a good lens into a lot of our learnings over the years, and happy to open up the floor to questions and more discussion. Thank you again.
Wow, that's amazing, Josh. It's fantastic. So I hear about Seamless, but I didn't know the diversity and how deep you are on the area of the patient care, patient coordination, and connecting patient with doctors. It's amazing. You're speaking C2SHiP. That's perfectly relevant. So one thing that in your talk you mentioned, and I love it because this is what we also recognize as a part of our research, is perception of the benefit. If the patient doesn't perceive the benefit, it doesn't engage them. Even though that the system is very cool and it's very and it may effective, but you need to articulate that. Or remember that for our automatic fall detection that we're working on it, we use it that, hey, that is detect when you fell down, but it wasn't enough. When we said that detect that you fell down and you cannot get up, suddenly they perceive the benefit. It wasn't about the detection, it's about providing the assistance. And now we are adopting technology acceptance model that look at the perceived benefit, perceived ease of use, and attitudes toward the use, and that's really important. My question is the second aspect is a perceived ease of use, and we are dealing with patients who are old that sometimes even a couple of steps that they need to do with the smartphone, it's too complicated for them. How you are handling, how you tailoring your app for those older population. I'm seeing that also Ram asking similar questions that if we are dealing with the older patient who has cognitive decline, do you have a different version for those participants?
Great question. At this point, we don't. I would say the most we've done has been more around broader accessibility challenges we're trying to solve. So that's why we've been focused a lot on reducing the health literacy levels to grade 6, to making it screen reader accessible to those who are visually impaired, and all kinds of other more broad initiatives. We haven't yet been able to dive deeper into topics around dementia and other accessibility areas. It's a good question. And I think we'll have to be thoughtful about how much we can do while still being relevant across the board. I think the best solution we've had in those cases has been encouraging a loved one to sign up with the patient. So at the very least, the primary caregiver of the patient has been involved to keep the patient on track. But it's a great point and something that we should certainly look into at some point.
Right. So I'm seeing that Dr. Naik is on the call. He's an amazing geriatrician, and I saw that also he's involved in your study. Dr. Naik, do you have some input or your experience of using Seamless in aging population?
Sure. I think the project that we did before wasn't necessarily aging focused. It was colorectal cancer patients. So yes, they were often older patients, post-surgical patients. But I think the tool was really quite good and for a population that that was in our public hospital system. So it's not a fairly sophisticated patient population. So in some ways, I think Josh's group really designed a very user-friendly, and that's a lot of what we did is how to improve the usability and to really make it something that patients who are post-op would find less intrusive and would want to engage with. And that's a lot of what we worked on and focused on is how to get them to use the platform on a regular basis as a self-monitoring tool for their post-operative status. So I think a lot of these principles can apply to tools that focus on an older, cognitively impaired, functionally impaired population.
Thank you so much, Dr. Naik. I'm seeing that also Dr. Moghadam is on the call, and she's working a lot with a patient with opioid problem. And I was wondering that, Dr. Moghadam, what do you think? Do you think that those kind of the coordination can help to manage the patient with opioid overdose or crisis?
Yes, that it would be incredibly helpful. We have found that the patients who have used an app, even a very primitive version of our app, have done much better in terms of managing their craving and what they're calling checking in with themselves. And so the next step is obviously to monitor how much relapses they would have, etc. So absolutely.
Thank you so much for sharing your expert opinion, Dr. Moghadam. So, Josh, another question that I have is, and I'm hearing in Petco from the hospital administration, is a liability concern. Sometimes sharing the information, if the doctor doesn't act on it, it can open up the portal for lawsuit for the hospital industry. How you manage them? How much information we should get from patient and share with doctors?
Yeah, it's a great question. I think one of the things we found to be really important is around setting expectations for patients. So for example, for some of our partners who are not monitoring that data whatsoever, and they're using this as more of a self-management program, both within the application, but then also as part of when patients are educated about the initiative, the expectation is set in those cases that no one is monitoring the data at those institutions. You're going to get feedback on the platform on how to either self-manage or potentially escalate to us, but you're going to be taking charge of that as a patient. We have some other partners where even if they are monitoring patients, there may be only certain time windows in the day where they are looking at the data. Maybe that's 9 to 5, Monday to Friday. And similarly, both in the application and also as part of the initial onboarding, patients are given that expectation set of when that data is being looked at. And if something happens after hours, they have to take a different path. And so the expectation setting has to be very, very clear and provided multiple times to avoid that kind of concern.
Amazing. Thank you. And I'm seeing that, Margaret, you're raising your hand.
Yes, I've been trained to raise my hands in Zoom. I had a separate question, but to your point you just made, is this integrated? Can this be integrated where home health, especially where we have many home health agencies are owned by the hospital, because that's usually who picks up the patient once they get home, could be integrated to help bridge that gap with the after hours? Or does the platform direct the patient when to reach out by making a phone call to their care provider, such as a home health agency if they have one, or call back to the hospital where they were discharged from? So that's just a comment and a consideration. But you mentioned cultural training and sensitivity. I was thinking that is probably your biggest opportunity. The telemedicine found that Blacks and Hispanics did not use video and smartphones, but I don't think it's because they didn't own a smartphone, because in Doxymetry's survey from 2020, they actually found Black households had more iPads than even whites or Hispanics. But the cultural sensitivity part of it in training, my family's from Jamaica, and when I go, dietitian consult and such, the food, I'm like, I can't find most of the foods that I buy and eat. Green boiled bananas, nobody covers in this country. But I think you have a lot of opportunities there. And I'm interested in how you're doing the cultural sensitivity information to make it, as you said, more individualized, because we have such a browning of the country and so many, immigrants.
It's a great question. Actually, we're fortunate that one of our partners, UAB in Alabama, among many studies that they've been doing with the data, they actually published a paper in the Annals of Surgery back in June 9th of this past year. I'm going to link it actually in the Zoom chat. And basically they looked into what was the variation in use of the platform based on different, I believe, ethnicities and payer status for the patient's insurance and all kinds of things. And there may be some interesting insights from that the group here might be curious about. At this point, I would say we don't have any very specific strategies that I think have been determined to get better engagement from different groups who may historically not have good engagement on the platform. We've had a few cases where some partners who have populations, for example, we have a partner where they have a large Indigenous population. And so they've added in very specific Indigenous resources and support that come through on the platform. But I think there's still a lot of interesting research to be done on different populations and demographics. But that paper was a good start, and I think there's a lot more opportunity to come.
Excellent point. I know that for value care, we know that addressing disparity is a very huge issue that we need to address. So there are tons of amazing questions in the chat box. Let's ask also a couple of questions from chat box. Marge asks, what other information would you like to see that could be provided by a sensor system? Maybe the idea of the closed loop. You have created something that is app, but there is no much closed loop that it seems that you're using in your system. Do you see a value of the closed loop and use of the sensor?
Yeah.
And let me also clarify, instead of having people self-report various parameters, could it come directly from a wearable device or something else?
It's an ongoing conversation with our health system partners and clinical staff. And the short answer is there's no technical reason why we couldn't do that. The challenge has always been around the logistics and practical implementation of that, especially when we think about different clinical use cases and scaling across an enterprise. So I'll give you a quick example. So, so one of the reasons why health systems like our platform is the fact that, I'll be honest, not every use case would benefit from, let's say, sensors. They like the fact that for some, use cases that don't really need, real-time biometric data being collected, they can still get benefit from seamless MD, whereas some solutions that are very focused on sensors and biometrics wouldn't be useful for an ankle surgery or something else, right? So that scalability has been valuable to health systems. And then from a practical point of view, there's always a question of who's going to provide the sensors, who's going to pick it up, who's going to clean it, who's going to return it for patients. And so I can tell you, we've had an academic medical center partner who originally wanted to use like Fitbits to track steps and have that data go into Seamless. And for us, that's not hard to set up. But then they end up deciding, well, we don't want to manage that. What if a patient doesn't return it? Who's going to pay for this? So they actually ended up buying pedometers that were much cheaper, and gave one to every patient and had them manually track their steps on the pedometer and then enter that into Seamless. And that way they wouldn't care if the pedometers never came back. And so it's one of those things where the technology makes sense in theory, but then when it comes to practice, what actually works at scale? And for that reason, we still haven't seen providers actually demanding to do these integrations, because then also they all use different sensors and there's no central sensor everyone uses. So I think at some point it's going to be cheap enough that you'll probably just give every patient a sensor and it's worth it. Yeah, a lot of talk about it, not a lot of implementation at this point, unfortunately.
That's true. I know, of course, it's changing. I remember again, Elon Musk just said that if you would like to bring in innovation, if you have 10% improvement, it doesn't fly. It should be really improvement that the patient start to use it. And definitely, of course, in healthcare, it's much more complicated as well. I'm seeing that our speaker of next week, Mr. Cleve Smith, has a questions. He's from Think Labs, and he's doing amazing also work in the area of the digital health at home.
Yeah, my question, very good talk. Thank you. My question is, you mentioned integration with Epic and Cerner, and it'd be interesting to have you expand a little bit on what that experience was like. How receptive were Epic and Cerner? Did you have to, did you have to work hard to get their attention, or were they open and receptive to the integration? And how difficult was it? If you can just expand, give us some insight on that. Thanks.
You got it. And Clive and Bijan, I pause. I have to run in a minute because I'm actually hosting this next call, but I'll answer your question quickly and I will have to hop off. I apologize. I would say the big lesson that we've learned is that at the end of the day, Epic and Cerner don't have the time to do something just because, we, a much smaller organization, want them to. The most important thing was that we had some health system partners who went to Epic and Cerner and said, hey, I need Epic and Cerner integrated with Seamless MD, because even Epic and Cerner will listen to their customers. And so the most important thing was having a health system customer partner go to Epic and Cerner and demand the integration. And then of course they'll show up and say, oh, okay, well, since we know there's real demand for it, then yes, we will work with Seamless MD to make this happen. If you don't have that demand from a health system partner, understandably, they're just not going to be incentivized to move forward.
Thank you so much, Josh. I know that there are a lot of other questions. With your permission, we share your email with others to ask your question and be in contact. But amazing talk, Josh. Thank you so much. And thank you all for the great contribution, discussion. Happy Friday and enjoy your weekend. See you next week.
Thanks, everyone.
Thank you.